So hello, everyone. My name is Dunja. I'm also a member of the initiative TechAcademy, and welcome to this English Impulse session this afternoon. I'm very happy to welcome our speakers, Professor Frauke Kreuter, who will join us in a minute, hopefully, and Dr. Katherine Morris. So before their session on their COVID-19 research project between the University of Maryland, Carnegie Mellon University, and Facebook, I will shortly introduce our guests to you. Beforehand, if there are any technical issues, please feel free to contact our technical support email. And if you have questions for our speakers, you can use the chat function and we will have a Q&A session after their presentation. So starting with Professor Frauke Kreuter, she's director of the Joint Program in Survey Methodology at the University of Maryland in the United States. And she's also professor of statistics and data science at Ludwig Maximilian University in Munich. She's an elected fellow of the American Statistical Association and a 2020 recipient of the Warren Matofsky Innovators Award. In addition to her great academic work, she's founder and co-founder of several initiatives and programs. Her thoughts on the conference title are, how can we design tech in the right way, and how can we leverage the potential tech provides to us? And I'm very happy that she will provide answers to these questions now together with Dr. Katherine Morris. Dr. Katherine Morris is a research scientist on the demography and survey science team at Facebook. She works on web surveys that inform decisions both within and outside Facebook, with a focus on survey measurement strategies for machine learning ground truth. She previously worked at NORC at the University of Chicago, which is an independent research organization. And there she supported several projects within the Population Research Center and the Center on the Demography and Economics of Aging. So we are very happy to have both of you here as our guests today at our very first tech conference, and I'm very looking forward to your session. So the stage is yours, and I hope that Frauke can enter our session as soon as possible, but Katherine, maybe you can start already.
Thank you so much for that kind introduction. We are very excited to present at the conference today, and we look forward to your questions after our talk. I can go ahead and get started with the first few slides, giving just an introduction to the project, and hopefully Frauke can join, because I'd really love for her to give the slides on both the construction of the University of Maryland instrument, as well as the bias correction that we've done using these data in order to make informed decisions. So we're presenting today on the partnership between Facebook and two academic institutions to field a COVID-19 tracking survey. These are Carnegie Mellon University in the United States and the University of Maryland for our global survey. The goals of our presentation today are to describe the data that we've collected since April 2020, to share early insights from researchers using the data, and to highlight challenges we encountered over the course of field collection, given both the speed and scale of the project in response to the pandemic. The partnership was the result of a call from public health experts to build a rapid syndromic surveillance system for COVID-19. Syndromic surveillance enables public policymakers and public health officials to make decisions before diagnosis data are available by using alternative data sources that include but are not limited to survey responses. Using surveys, we were able to collect geographically granular data, not only on symptomology, but also very importantly on key risk factors. And using Facebook as a sampling frame for this effort offers several unique advantages. Most importantly, Facebook reaches large segments of the global daily population, or population daily, with the technical infrastructure to provide bias correction that we believe allows us to make these over time inferences. And this is really key for this conference in particular, that this is our approach to how we think tech can help save the world, which is that when we have this large infrastructure, we can make key inferences that help us understand global problems, especially when we have the privacy infrastructure in place to keep people safe. And there are biases in any global survey, especially fielded on social media. But we hope that the trends, as I said, in the weighted survey responses will enable important modeling and decision-making efforts. For example, forecasting how many cases local clinics or hospitals will see in days ahead, providing an early indicator of where the outbreak is growing and where the curve is being successfully flattened, and also assessing the social and economic effects of the pandemic, as well as adherence to preventative policies such as mask-wearing mandates globally. I'm going to pause here on our agenda slide before we continue to see if we have Frauke in the conference. Frauke, have you been able to join?
I'm sorry, Frauke is still not here. So I hope that she will make it maybe at a later stage, but I think for now you can continue. I'm sorry.
Okay, Let me just check in with her real quick.
Sure.
Okay, in the meantime, I'll continue. So the structure of our talk today is we'll give an overview of the project structure, and in particular what we did to preserve the privacy of our users and the survey respondents. Then we'll go on to talk about the survey instrument for both the Carnegie Mellon survey as well as the University of Maryland survey, and the weights that we constructed to remove sampling bias from the data, or to rather mitigate sampling bias from the data. We'll also talk about some early insights using the data, and we'll reflect on data collection challenges and provide information on data access for those of you interested in using the data for your own work. So we designed this partnership with privacy in mind from the very start, but this required special consideration for the structure of the project and its science. Each day, Facebook invites a new random sample of users to participate. The survey uses a repeated cross-section design. Users may take the survey more than once over the course of field collection, but their responses cannot be linked over time. Users are sampled using a stratified random sample at the subnational level to ensure geographic representativeness in the more than 200 countries and territories included in the survey. Users who navigate to the survey are sent to the instrument hosted by our academic partners using Qualtrics. Facebook does not receive responses, but does calculate weights to provide correction for random sampling, non-response, sampling frame coverage biases using the random identifiers from the survey. We only share back the random digit identifiers along with the corresponding survey weights. Aggregated weighted estimates provided by UMD and CMU are then made publicly available, and non-aggregate microdata are available to researchers by request. And we certainly hope that you'll use them in your. If Frauke is here, I'd like to turn it over to her for the survey instrument and weights. If not, I'll happily continue. Frauke, do we have you on the call?
She's still not here, sorry. I'm trying to manage with her, but yeah, I think it's better if you continue for now. Thanks.
Okay. So the global and US surveys are fielded independently, though we have made the instrument comparable in important ways and continue to harmonize the instruments. The UMD Global Survey Instrument is available in more than 50 languages, and the survey instrument has 5 sections, including questions on health symptomology, as well as context with others, and mental health and economic security. The survey was developed in partnership with academics across multiple institutions in the US and abroad, and received extensive feedback from technical staff at the World Health Organization. The survey was translated by Facebook, which conducted an extensive translation audit, in addition to a back translation effort conducted by University of Maryland to ensure that the instrument was globally scalable. This level of care is essential for any cross-national survey of symptomology, especially given the specificity of some of COVID-19's distinguishing symptoms, such as anosmia or difficulty smelling, or the loss of sense of smell and difficulty breathing. The CMU US survey instrument is available in 6 languages, including English, and also has 5 sections. A key difference between the CMU and UMD surveys is the emphasis on symptoms among others in the household, as well as symptoms among others in the respondents' community, which have proven extremely useful thus far in improving the accuracy of CMU's forecasting models. However, the two are launching changes later this month, which will make the 2 instruments even more similar to one another. As of September of this year, we had received more than 20 million responses to the University of Maryland Global Survey from respondents in more than 200 countries or territories globally, averaging 230,000 responses every day and 1.6 million responses every 7 days. We've received more than 10 million responses to the Carnegie Mellon survey in the United States, averaging 71,000 responses every day and 500,000 responses every 7 days. Facebook provides analytic weights that adjust for non-response and cover biases. By non-response bias, we mean that some sampled users for the survey are more likely to respond to the survey than others. To adjust for this, Facebook first calculates the inverse probability that sampled users complete the survey using their self-reported age and gender, as well as other characteristics we know correlate with non-response to other web surveys that we conduct on platform. We then use these inverse probabilities to create weights, after which the survey sample reflects the active adult user population on the Facebook app for each geographic entity in the survey. By coverage bias, though, we mean that not everyone in every country has a Facebook app account or uses their account regularly. To adjust for this, Facebook adjusts the weights even for the distribution of age and gender in the survey sample reflects that of the general population in each country or territory in the sample. In most countries or territories, this adjustment also corrects for the distribution of the population across subnational administrative regions. Making adjustments using the weights ensures that the sample more accurately reflects the characteristics of the target population represented. However, we encourage researchers to consider whether further adjustments are needed for their use case. The survey weights are available for 115 countries, but may be revised as Facebook and its partners assess sample coverage. It's important to emphasize that the weight value assigned to each respondent cannot be used to identify them, and the weights are shared by UMD and CMU along with the survey responses only for researchers who have the relevant data use agreements in place. There are promising signals that the symptom surveys are complementary data sources from which to answer time-sensitive and public health questions. US level rates of COVID-like symptoms correlate with rates of diagnosed disease burden, as you can see here in this scatter plot of the daily new case rate along with the CLI percentage for each US state. And these data are from our CMU partners. Then here too, you can see the correlation between the CLI percentage rate as well as new hospitalizations over time, using just one example from Florida in the United States, showing that the case rate actually tracks quite well with new hospitalizations. And we're continuing to dig into this correlation globally and across subnational regions within those countries, for example, in Brazil or Nigeria, in order to understand the value of the data in lower resource settings, as well as more diverse settings globally. Aside from CMU and UMD, there are now 15 institutions working with the non-aggregate data from at least one of the surveys. For example, IHME is using mask wearing in their model, which shows a significant improvement in its predictions. With more than almost 2 billion users worldwide, Facebook provides a unique window into the world. And we believe strongly that when privacy is protected and data is shared responsibly with the communities that need it, it can improve well-being and save lives. These data are available for responsible use, as I've emphasized throughout this talk, and we hope you'll use them for your research. The aggregate weighted estimates of COVID-like illness are available via publicly accessible APIs hosted by both UMD and CMU. The non-aggregate data are freely available by request through a portal on Facebook's Data for Good website. In addition to partnering with UMD and CMU to collect the symptom surveys, we also provide several additional data sources to help with disease modeling efforts through the Facebook Data for Good program. We encourage you to investigate them for your own research. If you have any questions, you can reach us at COVID-19 symptom survey at fb.com, where we monitor questions and share them with our partners at CMU and UMD. Thanks so much for your time, and I look forward to your questions.
Thank you so much for your time and these amazing insights. I hope to see you at our next conference again. And yeah, many thanks to you and also to our participants. I hope you have a nice day and maybe you want to join one of the next sessions. So yeah, have a nice day, all of you. Bye.
Thanks so much, everyone. Have a good day.
Bye.